Dan is a wet-fingered orthodontist who's been involved in academia as well as clinical practice throughout his career. And you've had a really neat evolution throughout your career. And I think that journey and the story of your journey tells a lot about how much we can continue to learn and advance.
I'm at the point now where I feel, I've had a lot of experience. I've seen pretty much a lot of things and we've seen it all. And I'd like to share it with people. The whole analysis of airway and nasal cavities and pharyngeal, upper and lower pharynx and things, that kind of came with time.
There's a lot more happening than just treating the teeth of a 12-year-old to 14-year-old that a lot of us are taught to do in our training programs.
So true. It seems like more of the courses seem to be taught by well-educated general dentists and pediatric dentists because maybe there is a void in our formal education system. So I've been in practice 40 years. Maybe the first 30 or so were traditional, just like I was taught in school, orthodontics. It's been the last 10 years that I took it upon myself to learn these things with the advent of new technology. Now that I do phase 1/phase 2, life has been simple. If you get to control transverse from one, the rest of your life is easy.
7, 8 years old, they're going vertically, they've got the antegumenal notching and a steep mandibular plane angle, and I would go fix the transverse and it would redirect their growth.
The orthodontics is so much easier.
Yes, I'm so glad you mentioned that because
the orthodontics is so much, nothing scares me. Where are all the impacted cuspids?
I was waiting for you to finish. I was literally going to say to you, how many impacted canines are you seeing now?
Not many. As far as patients that we are in charge of, we rarely have an impacted cuspid. Preventing this stuff does take a little bit more time, but it does prevent the morbidity at the end. We start with the face, work in,
love it,
and finish with the teeth. Which is just so you know, I'm sending all the neighbors. So-and-so just had his tonsils and adenoids out. No more night terrors, no more snoring. We don't have to rent two hotel rooms when we go on trips. All of these. Now
life-changing.
And she stood up in the middle of my clinic and was shouting this so every mother in the place could hear it. All it takes is a few life-changing experiences like that for patients, and you realize I'm really doing something good. I love it. It's the best feeling in the world.